This podcast is brought to you by Kyoto Japan Automotive Group, a company which I've known personally for over 20 years, and your one-stop shop for tires, batteries, and auto parts. Visit their website at www.kyotojap.com for more details. Thanks for downloading the McKay interview. My guest today is Professor Benoit Dubuis. He's president of the Swiss Academy of Engineering Sciences, president of the Fondation Inatis, and professor of the Faculty of Medicine at the University of Geneva. We discussed two important areas: the place of food in health and nutrition, and the security of food and vaccine supply. Of course, we discussed many other things too, but our main areas of conversation are the role of functional food in public health and how Switzerland can best provide and protect its citizens by ensuring the supply of vaccines when the next pandemic arrives. I hope you enjoy the podcast. Hello everyone. An important conference took place yesterday under the auspices of the Swiss Academy of Engineering Sciences. This august academy had gathered together in one room an important group of people, including a Swiss federal councillor who came via Zoom, the CEO of Nestlé, and many luminaries from the fields of medicine, the Federal Office of Agriculture, the World Health Organization, the ETH in Zurich, the EPFL in Lausanne, and others. The topic was of fundamental importance to all of us: functional food in health and nutrition, and the security of our supply of food and medicines, especially in times of national crisis. Now, I don't need to exaggerate to you in any way the significance of these topics. My guest today is the president of that academy, known by his German abbreviation, SATW, Professor Benoit Dubuis. He's also president of the Fondation Inatis, which manages various programs in support of innovation and entrepreneurship, and professor at the Faculty of Medicine at the University of Geneva. Now, he's no stranger to listeners to this program, having been my guest around 8 years ago when he led the well-known campus biotech in Geneva, which is where we are now, as executive director. I had the privilege of being the moderator of the high-level debates yesterday, and have invited him on my show today, the 14th of May, because so many of the issues which were discussed were of vital interest that I wanted to share them with you quickly. Welcome back to the McKay interview, Professor Dubuis. It's good to have you with us once more, Benoit.
It is my pleasure to be with you.
Benoit, my first question is an obvious one. What were the paramount messages, the information of overriding importance that you and your colleagues at the SATW Congress wanted to come out of yesterday's meeting and high-level debate? Just please summarize them for our listeners.
So, thank you very much for asking. As you know, the main role of the academy is really to find out what are the coming technologies, where are we going, and the second is really to understand what will be the effect of this new technology on the population. These are key, but I think there is a third thing that we need to study is where do we stand as Switzerland within this technological world, because it has a tremendous importance not only to guide us in education, in research, but also it should be highlighting what we expect from the private sector and how we can help them. And it's true that some years ago, nobody was caring about sovereignty except at the geopolitical
That's true.
level.
That's true. Yeah.
Today, everything changed since the pandemic. I think you probably all woke up once and you heard that actually we were missing some things which seems to be obvious.
So 2020 was
everything really the turning point,
yeah.
yes. Because suddenly there was no longer ethanol simply to produce things to disinfect ourselves.
Yeah.
The second it was really to protecting mask. And after you can go towards something which is more complex as the vaccine. And that was really one of the topics we questioned yesterday. Mm-hmm. Is really to find out where do we stand as Switzerland and what action we should take simply to be independent in a positive way in case something would be missing. how do we be not only surviving, but how could we be living in these situations?
Okay. Yeah.
And therefore, it's a long discussion we had started within the academy since 2 years.
I see. Okay.
And it's very difficult to have a broad discussion because each sector is different, and the answers are also very different from one sector to the other. Last year, we touched the case of data, and the second was energy, which is naturally a huge question we are asking, and we need to find out solution. We need to anticipate what could be happening. And this year, as you say, we wanted to investigate in more details the food questions and the access to medicines, to access to devices, to access to vaccine.
Okay.
And this is our goal, because there is not only one perspective. It's really to bring in people which are knowledgeable on the field, which have experience.
That was clear.
And these are the panel you've been
That was clear from the distinguished group of people in the room. But the programme divided neatly into two parts, Benoit. Part one was functional food in health and nutrition. Part two, security of food supply and the supply of medicines. Let's address functional food in health and nutrition first. First of all, what is, in your understanding, functional food, and what is its place in the diet of a healthy population and the part of that population which is ill? I'm just curious to know how you see it in simple terms.
There's a fundamental difference between the food and the nutrition.
Yes.
The food is the food intake what you take. When we talk about nutrition, is really the effect of metabolism, simply to make use of food, and after to produce the nutrients and the energy for the body. And it's very true what you say, is that for a long time we really concentrated on the food aspects, the intake. And we were questioning, is it enough to feed the planet, to feed the population, and so on. And all this discussion was about the energy you bring to your body, to see if it can function or not. But now, thanks to science, we can go much further. And we are questioning what is really needed for whom. And there are major differences between all of us. There are people which are requesting some more of some of the nutrients, and based on the way they live, and based on their age, and based on their needs, we can really anticipate what is expected, and really being working on it.
And you're not talking now about people who are ill, you're talking about people who are in relatively good health.
I'm talking about all the population, because the population is very diverse. We have young people which need to grow, we have elderly people which are mostly at home, and actually sometimes they have an unbalanced diet, and we have people which are doing sport, we have people which are more sedentary, and we need to address all these needs. And we understand more and more the metabolisms of these people. We understand more and more the habits they have and the needs they have. And we can really design some diet which are appropriate for this different set of populations.
Yeah.
And this is something what is made possible by the research which was done not only in the labs but also working in clinics where people can study it. And when we are talking about genomics, about nutrigenomics and so on, they are all new science. When I say new, they are coming from a couple of years, but we learn a lot. And now, what the industry is doing is really to learn even more and to adapt the diet and their products to these specific needs.
And in your experience, with your very good overview, do you think there's agreement or dissonance between growers, farmers, manufacturers of food, medical profession, scientific profession? Do you get the sense that people are moving more or less in the same direction, or is there a disharmony somewhere?
I wouldn't talk about the disharmony, because the ultimate goal is the same. We need to feed the population, and second, we want to have a healthy population. But each of these groups that you are mentioning are having a different focus, a different perspective, because they have different customers. The farmer is producing for the industry is producing for the customer at the end. And each has his own restriction and his own point of view. And therefore, it's very important to bring all these people in the same room to discuss what can be done. If I make reference to the discussion we had yesterday, I think one aspect which was touched was not only about technology, not about it was possibly a bit over exaggerated the AI which is introduced in the food systems, but simply the education of the population. People need to understand what they are eating, and it's not only by reading the note or the quotation on the product that you are an expert in nutrition. And we need to educate.
I agree.
And one of the points which was brought out is what can we do at the very ground level of the education in school.
I was surprised to learn it's not even taught in school.
To be one of the major topics of.
And even medical doctors are not required to have this as part of their medical training.
Probably it will be changing.
Yeah.
But in medicines, you have so many specialties, and you have people which will be highly knowledgeable on that domain. But there are other where they have knowledge, but which is simply basic.
Now, sorry to interrupt you. This is an unfair question, but you're the best person to answer it. You're a medical doctor, you're an academic, you're a businessman, you're an entrepreneur, you have all these things under one hat. Give us some sense of how the different interaction between these things, and particularly private enterprise vis-a-vis science and medicine, just in your experience.
What I try to do in my life is really to make bridges, to have platforms to bring everybody around the same table to discuss what are the priorities and how can each individual, each company contribute to the goal we've been fixing. I'm very surprised, not only on the field of food, not only on the field of medicines, how diverse the world is, and everybody has his own truth, and he believes that actually he's right, and he sees the priorities, which sometimes are very different of the expectation from the population and from the health systems.
That's right.
And therefore, we need first to make sure that people come to a place. Second, establish trust, because if there is no trust, there is no good discussion. They will be listening, they will not be hearing the other people. And after we need to make sure that they have a joint plan to see how we can contribute. I take another example which is not related to food. Last year, as I told, we were discussing about energy. And I was very surprised because we had producers, we have people which were doing the transport, we had people which were thinking of the next technology producing energy. And I really got the impression they never talked before.
So this is producers of energy, and the people in what you might call the logistics of energy?
Yes, exactly. And it comes two examples which seems to be terrible.
And just in the small country of Switzerland, they're not talking to each other.
I'm not suggesting they are not talking, but they gave the impression they were not talking.
Okay.
For example, they wanted to put a solar panel in the Alps, and after questioning how can I transport these electrons, it seems to be obvious.
Yes.
If you wanted to make a major facility for producing energy, you need to bring that down to a customer. And sometimes I think we should really talk more, not only seeing our own perspective, but seeing the big picture. And that was really the goal of the Congress we organized yesterday on the field of food, on the field of medicines. And I was fascinated to see that people are very creative and they have ideas. But even some initiatives which seems to make sense were underpublicized, nobody is talking. For example, we were talking on vaccine production and maybe to bring a bit of sovereignty in Switzerland. Who knows about the Swiss Vaccine Institute? Very little people. And it should be at the core of the press. It should be in the core of the media, because it's certainly one of the actions. I'm not suggesting it's good or not, but at least we should know that people are thinking in this direction.
I remember the first time I met you and your friend and colleague Jesus Martin Garcia, and he explained to me the difference between invention and innovation. It's good to have an idea, but you've got to somehow channel it into...
The difference is probably between an idea and innovation.
Exactly.
Because an idea, everybody is waking up once with an idea.
Yes.
But after to make it
happen.
And innovation is what is an idea put in use.
Exactly. So
you mean
over and over again.
Exactly. And somebody need to buy it and to make a business out of it. And therefore, one of the questions you asked me yesterday was simply the role of the industry, the role of the entrepreneurship is really this business link, simply go from an idea to something which can make use of.
Let's look outside Switzerland just for a while. But before I do that, I just remind our listeners that my guest today is Professor Benoit Dubuis. He's president of the Swiss Academy of Engineering Sciences, and we're talking about food, nutrition, and security of food supply and access to medicine. We in the rich West are living longer and longer. I'm already in my mid-70s, and people tell me I should expect to live until I'm in my mid-80s. I hope so. And yet we know that in so many parts of the world, if you're lucky, you get to 55, 60. Wow, that would be fantastic. Do you feel that that was addressed yesterday, and do you feel optimistic that we came closer to narrowing this gap between us who do so well and those who do so badly? I mean, what was your feeling?
I'm always optimistic, to be honest. Because when you are mentioning that life expectancy in this country is not as long as it is here, let me remind you that it was exactly the same at the beginning of the last chapter.
That's right.
And
yes.
Therefore, we see the improvement we've been doing. Now, I think the problem is a bit more complex than only considering food, for example, or medicines. Because there we need to have an infrastructure which is serving it. Yesterday, it was very clear that the planet can feed the planet.
Yes.
But not at the right place, or it's not exactly what we need for some part of the world. And it questioning all the infrastructure is questioning the logistics to get there. I take a very personal example. I had my daughter. She is an MD, and she made she spent some time in Cameroon, and it was very telling because we just wanted to find out after the couple of months she spent there how we could continue to help these people there which are missing a lot of things, and especially infrastructure in medical. And she told me, and we were questioning, what can we do? Do they need gloves? Do they need medicine? Do they need drugs? Do they need? And we are always thinking of very complex things. And she was simply telling us what we need there at most is water. Clean water.
Yeah.
We need to have electricity because there's no way to operate a hospital if you don't have access to electricity. Yeah. And therefore, I'm not neglecting the fact that we need to make sure that food access to medicine is important, is key, yes. But on top of that, there are basic requests which need also some answers to make sure that actually people will at the end benefit from what we could be sending as an help.
Benoit, let's just move to vaccines and supply security of medicines. It's clear that the debate yesterday, there was a worry about the continuity of vaccine supply in an emergency, and a worry about a rerun of the pandemic problem we had back in 2020-21. What's the role of governments in this area, and particularly, let's say, at home in Switzerland? What is the role of government in ensuring the security of supply? What's the role of pharmaceutical companies in securing continuity? And what's the role of medical science in a more general sense in the whole area of security of medicine?
I think yesterday we had a very nice presentation by Professor Dubuis, who is somebody which is not only dreaming the future but who is driving and actually doing action.
This is Patrick Dubuis,
the former president of the EPFL. Well, I very much appreciate the presentation.
Yeah.
Now, back to the vaccine. I think first we need to identify where is the problem. Was it a problem in Switzerland because of vaccine?
And we're talking about Switzerland.
In Switzerland.
Yeah.
I was very surprised, to be honest, that in general, the medical, entrepreneurial and industrial community could come with a vaccine so quickly and capitalize on something which was fairly new, which was mRNA vaccines. Because we know since a long time that there's a huge potential behind mRNA vaccines or mRNA drug development, but nobody turned it to reality So it was still in labs by some company as Pfizer, as Moderna.
So just to ask you, sorry, let me just stop you there. As a non-medical man talking to a medical expert, we knew about mRNA before,
Yes, clearly.
not 2020, but...
Yes.
Okay,
But
go
there
on.
were many problems which were linked to that. The first one is the stability of mRNA, because when you inject in blood, we have enzymes which will be degrading it.
I
and
see.
we had to solve these problems. And it took years and years simply to develop. And once, when we've been facing this problem and we were in need of vaccines, two companies, people which were visionary, which been working there, said, "Oh, let's concentrate on vaccine." And in a couple of months, they succeeded it. I was really surprised. The second is, as you know, into regulation for medical stuff, we need to have accreditation, we need to have quality control.
That's understandable. Yeah.
That is perfectly understandable. But usually it's a tedious process.
Sure.
It takes years for doing it. And everybody was forced because of the demand, really, to act speedily. And that was done. But to people who were questioning, especially in Switzerland, why are we not sovereign on that? Why? How can it be that actually neither Moderna or Pfizer were a Swiss company? Because if we look at Switzerland, is well known in the pharmaceutical business, and Roche was not in the avant-poste. They were not the first to do it like that. And if we look back, we can see that there were very few companies which were still active in vaccine. Why? Mainly because it was not profitable enough.
There's no money in it.
And exactly. And therefore, the market were not our. Most of the market were in the country we've been talking about that. And therefore, we had companies as Merck, as Sanofi, as GSK, which were leaders. But even them, they were not the first to produce. They've been trying. They've been proposing some vaccines which were a regular vaccine. We are more used, but one which really were as a game changer were these mRNA coming from, and it shows the importance of capitalizing on innovation. And innovation is key on that, especially if you need to act speedily. Now, the question you are asking is, should we be producing a vaccine in Switzerland?
Yes, yes.
So there is no doubt that in Switzerland we have all the skills to do it.
We have all the skills.
Yes. So we have people which are perfectly trained to do it. We have companies which have the access to the equipment, and especially to people which know how to manage it. And we have superb industry which could make the link to distribute that.
So where's the problem?
There's no problem. There's more a question, and the question is more a question of policy. Do we want to do it, or do we trust the industry to do it?
Okay. Yeah.
And in our case, with the vaccine production for COVID, I think the trust was there. We had companies which delivered. Were we the first to be delivered? Possibly not, but we access them. Nobody has already blamed the company because they were late into supply. It's true, at the very beginning, they had their very problem because they had to serve the planet.
Sure.
There was not a single market on which they could concentrate. My question is more to find out how can we make that sustainable. Having an institute working on vaccine, understanding it, is definitely key, and I'm really in favor that the Confederation is supporting it, and it is what was declared yesterday as the Article 15 of laws to give such a subvention. So we understand that the way to technology and so on.
Just clarify Article 15. Just explain that again, please.
In Switzerland,
and this is the Constitution you're talking about.
Is a law on science and education, where money is going to the high schools, money is going to the university, to the ETH systems, and there is a pot for sustaining initiatives which have a relevance at the Confederation level. and that will be included and will be sponsored by this article, which allows that.
I see. Okay.
So the money should not channel to the university and after to be rechanneled in such organization. It can benefit directly institutions as, for example, Campus Biotech in Geneva, as for example, the CSEM, which is sponsored through these ways, and the Swiss Vaccine Institute will be sponsored, as we heard yesterday, by 20 million starting in 2025.
Yeah.
So it's a good thing. Now, how far should we go? What will be the partnerships that we need to establish with the private company? Because we should not forget that it's nice to develop vaccines, but at the end we need to distribute it.
Yes.
And second, there are in between some IP questions.
Intellectual property.
Property questions. All of that need to be managed, need to be aligned, to make sure that there will be a benefit. To take a less complex discussion, as it was this discussion about the mask.
The mask,
the protective mask.
Yeah.
At the beginning of the pandemic, everybody was surprised that we had no stock.
Yes, I remember.
And basically, every citizen in Switzerland was asked to have to stockpile some, but very few, including me, knew that I had to do that. Yeah. And therefore, with the interruption in the logistics, suddenly there was no mask, or we had to reserve the mask for the clinical application and for some other applications. And the question was very clear, how can it be that Switzerland is not able to produce its own mask? And it was the same situation. We have the skills, we have the workforce to do it, but we have no equipment to do it. And then it proved that actually for a long time we had to stockpile mask, protective mask. But into length and during the duration when we were talking about globalization, access to different source of production, there was no need for that. People were trusting the logistics simply to deliver from multiple sources these masks.
That's right.
But at the time we've been facing the pandemic, suddenly there was a major breakdown in the logistics, and that was not affecting only one country, it was affecting the planet. And in this situation, not having any stock proved to be a problem. Now, the question I'm asking myself, people came with the idea that we should have a production facility just in case. What does it mean? It means that we need to make an investment, and it's perfectly fine for the Confederation to do it, but after we need to maintain it.
Yes.
We need to test it. We need to have people which know how to operate it. So probably for the next coming years, people will be agreeing to support it. But I'm sure that in 10 years, somebody will come back and ask the question,
why is it there?
Why is it there?
Yes,
and he will probably bring exactly the same argument as when we decided to stock here, suggesting, as a globalization, we can buy from all these countries. He will be questioning it, and suddenly we'll be facing it.
Yes, exactly.
In company and as well as in organization, we need to make these matrix risk.
Yeah.
And,
no, you're right.
And COVID was in none of them, because nobody could think that actually we will be facing something sufficiently disturbing to disturb all the...
Or maybe it was, but the people that voiced that opinion were just not listened to by the people who made the decisions. I've heard this said also about the crash of 2008, and said Queen Elizabeth, said at the Institute of Economic Affairs, she was visiting the IEA in London, and she said to the director, how did no one see it coming? And some economists that I know said, but Michael, some of us did see the crash coming, but nobody would listen to us.
I think after something is happening, many people saw it before.
Yeah, okay.
I think so.
That's also
but there,
true.
We were not prepared, even if the scientists and all the clinical authorities were suggesting once there will be an epidemic which will be touching all the planet. But we did not took that seriously.
Yes.
And therefore, what we plead is first to bring these people together to say what can we do? What will we be in the position to sustain such an action for long enough? The question which was also addressed yesterday was, will it be happening again? And
the pandemic.
The pandemic.
Yes.
And the answer is yes.
Yes, it was avian flu was mentioned.
We will be as a better prepared.
Yeah.
The question is, at the time, probably not. But we can do things simply as to anticipate as what is happening, but it has a cost. And it needs as a really the adherence of all the populations. And this is typically on that we need as a to discuss, as we need as a really as a to bring as a the minds as a together to convince the people that if we are there, if we take as a this action, it really makes sense. Or after a couple of years, everybody will be forgetting it. Is simply already the truth. Now, when we are talking on the pandemic, it was 3 years ago. Some people forget it.
Yes, yes.
And I'm surprised by organizations as the WEF, for example, which are backed to globalization, without
the World
really
Economic Forum.
Yes, exactly. Mm-hmm. Without considering what was seen as a major failure of all these liberal way to see that actually the planet is feeding everything. And I think we need to be cautious. We need at least to have this discussion, and we need to have a consent on the action that we want to take.
Benoit, thank you for the clarification, for bringing it all together so well. Points of science, of health, food, and vaccines. Thanks a lot for that. My guest today has been Professor Benoit Dubuis, President of the Swiss Academy of Engineering Sciences and President of the Fondation Inatis, and Professor at the Faculty of Medicine at the University of Geneva. Thank you so much, Benoit.
It was my pleasure.
Thanks for listening to the Mackay Interview podcast, brought to you by Kyoto Japan Automotive Group, a company which I've known personally for over 20 years, and your one-stop shop for tyres, batteries and auto parts. Visit their website at www.kyotojap.com for more details. And you can find more podcasts on Anchor FM. Just Google Mackay Interview Anchor FM. Thanks again for listening.